The Western Cape Health Department says 333 children with firearm-related injuries were treated at public health facilities throughout the province between the 1st of January and the 12th of June this year. 58 of them died as a result of their wounds. Research conducted by the Red Cross War Memorial Children's Hospital in the past revealed that the majority of children receiving treatment for gunshot wounds had unintentional injuries, often as a result of getting caught in gang crossfire. We speak now to Director General at the Department of Women, Youth and Persons with Disabilities, Advocate Joyce Maluleke, who joins me now. Good morning, DG, and thank you so much for your time.
Thank you very much.
DG, every single week there are reports of children who are getting caught in the crossfire of gang violence. This is not only a form of abuse, but it is a pandemic in itself. What is the department doing to tackle this crisis?
I would like to explain the mandate of the Department of Women, Youth and Persons with Disabilities, but also to indicate that we are responsible for women, youth and persons with disabilities, but that doesn't mean that we don't focus on children. We do focus on children. First of all, violence in South Africa. South Africa is said to be a country which is at war within itself, the way people are dying, or children, or women, or youth, or all those people. So as a department, we've launched a program called Treating Gender-Based Violence and Femicide as a Pandemic. I know that I'm talking about gender-based violence, but the program focuses on prevention of crime, not just violence against women, because it involves the community in preventing violence. I know that most of the people will talk about the criminal justice system, case backlogs and all those things. All those are not going to end gender-based violence if we don't prevent gender-based violence. So the program on treating gender-based violence as a pandemic looks at educating the public to be able to stop, to prevent gender-based violence. We're also looking at parenting, because we believe that how you raise your child can help us to be able to deal with violence and crime in our country.
You speak of prevention, which would seem that prevention would require some kind of sectoral collaboration. Are there any talks happening with other departments, for instance, the Department of Police in this matter?
Yes. Our department is the lead department in the implementation of the National Strategic Plan on Gender-Based Violence and Femicide. There are about 7 departments. There's private sector, there's labor, and there's civil society. So we are working together. Prevention requires all those departments also to play a role.
Yeah, and prevention.
And the society.
I was actually going to ask about the society. What role does the society play in these preventative measures?
As indicated earlier on, that we have a program which we are working together with the Department of Social Development on educating on parenting. We believe that, first of all, how you raise your children plays an important role, but also the communities need to know that gender-based violence is gender-based violence. I'll make an example. We were at Sibanye Stillwaters last week. It was launching a center for women, for youth and persons with disabilities. One of the pastors who spoke there said, I was not aware that beating your wife or beating your girlfriend is gender-based violence. All I knew was rape is rape, but the others I didn't know that it was gender-based violence. The challenge that we have is that even in societies, people don't see gender-based violence as gender-based violence. A girlfriend will say, he loves me, he's very jealous, that's why he assaults me. And yes, it's gender-based violence. So we are working with communities. We've launched in KZN, where we want to work with communities. We call it family to family, individual to individual, council to council, municipality to municipality. All of us need to be doing something to end gender-based violence, to raise awareness, but also to ensure that we no longer, if we were perpetuating violence, we no longer do that.
A big part of the role that you play, especially in creating awareness, is, of course, to facilitate the transformation of the mindset, which then hopefully will transform people's behaviors. Are you seeing, or are there any mechanisms in place to actually track this development within communities or within societies where you are applying all of these programs?
I think, as I said, that we are working with parents. We want to start at that level where we influence or inculcate the culture of respect of the next person. With older people, yes, we are coming with programs to encourage them not to perpetuate violence, but it's a difficult program. And I think everyone, including media is part of government. Media must also do something. I think when we report, the media must also account in terms of what is it doing in terms of raising awareness or changing of the mindset. Because people listen to the media and they look at TV and all those and they mimic what is happening there. So the implementation of the National Strategic Plan on Gender-Based Violence and Femicide says the whole society approach. Everyone, private sector, civil society, the media, and everyone, we have to play a role in ending gender-based violence or in ending crime or violence in South Africa.
Let me ask the question differently. Are your programs within the department, DG, making a difference? And if so, how do you know?
Yes, they are making a difference because in the communities where we are establishing the rapid response teams, you can see that the communities start understanding and they're working with other community members in order to end gender-based violence.
All right. Thank you so much for your time, DG, and truly wishing you all of the best in this fight against what is essentially a crisis.